Subscribe now and press the bell icon. Never miss an update.
Well, my name is TV Sairam, and I have been in Indian Revenue Service for last so many years. Actually, my music journey must have started very early, when I was a child or something like that, because my mom used to put me in a cradle and then she used to sing, which I even recall now. And she used to give half of the song. Then she used to always tell me that I used to repeat the second half, actually, not the first half. So I was all the time one step ahead of her, and that's what she used to tell me. And I also recall that I used to babble and all that. I remember that. But that was the start of music, because I don't think music can be learnt or can be educated or anything like that. It is something too personal, because music, we are born with music, we are part of music, we are all manifestations of vibrations. So we are all musical basically. So if you are already musical, what's the music you are going to have? It is like adding salt to the seawater, which is already having so much salt. I happened to see one gentleman called Alfred Tomatoes in 1975 in Paris. I was a student in Paris University at that time, and I had spent a lot of time with another friend who is a musician and who is a pianist. So he took me for a lecture of Tomatoes. And I happened to meet Tomatoes also. Only 5-6 people were there in the lecture audience. So he gave a lot of personal attention for me also. He was very curious why this Indian boy is sitting among all whites and all that. So he asked me also, how is that? And I said, I've come for a training here, but I love music, so I wanted to be here. So he was very happy when I said, I love music. So it like birds of same feather, we all mixed together. Then he shared some points about particularly about Western classical music, which can be used for healing purpose, particularly concerning the mental issues. I am blessed to have met him, so that that came in the back of my mind when I had some serious problems in my life. So I happened to write a book called Self Music Therapy, based on my experience, how one person can be a doctor, a musical doctor for oneself, and how a person can select a particular music and then can work on it for betterment of his issues. Actually, therapeutic needs could be met with music. We are all the time talking about body, and we have very little time for mind. I started actually researching on Indian ragas, actually, because a lot of literature available on Western classical music. So I thought the Indian ragas were a neglected system and people didn't know. Even there also people were having all sorts of myths and all sorts of stories and anecdotes, and nothing scientific was done. So my aim was to make it as scientific as possible. And then I started writing on music therapy, and I happened to write about a dozen books. Some of them got published in Indian and foreign languages. I decided to form an association called Indian Music Therapy Association. So this association is unique. It's a unique one because here you have medical doctors, you have psychologists, and you also have people who are well versed in music, like musicians, musicologists, and so on and so forth. They are qualified music therapists now because they are given some practical training also, and some of them who can afford to visit some hospitals and all, they could be arranged by us, and they also felt very comfortable when they visited hospitals and saw patients, smiling at them, like cancer patients, like people who are suffering from pain and all that, like small children who are isolated in a ward and all that. In fact, much scientific work is available on the impact of music, as a medicine, for instance. So, especially for pain relief, the music is one of the best medicine, because it doesn't have any side effects at all. Whereas the medicines which are available in the market over the counter, they are not very comfortable, and the people who consume those medicines like Brufen and all, they have to go through hell actually because of their side effects. So I was surprised to find many papers in which practical work has been done both in the West and also in India. This has come to a light now that instead of using these pain relievers and all, which are dangerous, we must mix them with music actually. At least 50% of that medicine could be reduced. That is what many papers, many researchers from various parts of the world actually, they have come to this conclusion. Drug rehabilitation also, we have trained some of the people who are drug addicts in self music therapy practices. So it is something like a meditation, you can say, but it's a different type of yoga called Nad Yoga. This is also very popular in India, and Nad Yoga, Rag Chikitsa, these are all our ancient treasures in music therapy. So a person who has got certain problems, he can try, because it doesn't have any side effect. If you like that particular rag, then you can do that. If you don't like, don't do that. As simple as that. But there are many people who are benefited by these activities, because we get feedback regularly. We get feedback through email and all that. So what I am trying to say is that music can be a great complementary medicine. It cannot be a standalone medicine like any other medicine, like Ayurveda or allopathy or any other pathis. But this can be a very effective medicine, and also at the same time cost effective medicine. So all one has to do is to tune oneself for this new type of medicine, and it's very simple actually. Everybody in India can become a music therapist. That is what our sort of conclusion, because it's not a very complicated thing. Certain basic requirement is there. If you can do that comfortably, like anyone can do meditation, you need a little bit of guidance, that's all. Then you can do breathing, pranayam, everything. It is music therapy is exactly in that, as I told you, it's Nad Yoga actually. So you can, everybody can do, because in Indian solutions are all very simple, very direct, very easy to follow. There is no need for training. I told you there is nothing called music education, because we are all born of music. We are all born of vibrations actually, and we continue with those vibrations, because all manifestations in the universe, there is a universal manifestation. The whole thing is vibration, and they have calculated 432 hertz as the ultimate sort of thing that that will give happiness to people and all that. So actually that is what a scientific calculation. But basically we are all products of vibration, and it's much easier for us to synchronize. Our mind is also vibrating. Our body is vibrating. When I talk, I am vibrating. There is a movement. There is a movement in music. There is a vibration in our heartbeat, in our blood circulation, everywhere. So it's a natural sort of phenomenon. We are trying to synchronize with nice music, so that our mind, which is sickly, becomes very, very healthy. Therapeutic aspects of music is not new to India, because in India, even in, I've read about Arabia and other places, even in China, that there were arrangements for music therapy in the hospitals in olden days and all that. To use the name self-music therapy, it is a very ancient form of music therapy in India. It's not new for people, because you must have come across, even when I travel to rural areas, sometimes 10 ladies join together and start singing songs when the rain is going on. They are enjoying life, they are becoming relaxed with that. And even when the farmer is doing hard work in a field and under the sun, he also murmurs some songs, and then he forgets about it, and then he does more competent. Even the soldiers you have seen in army and all that, they use music for long march past. They never feel tired because the drum is going on and on and on. So actually music therapy is not something new actually. It may be something like old wine in the new bottle.